Hi, Robert.
Hello. Hi, Andy.
Thank you very much for agreeing to this interview, Robert. Can I ask you to begin by introducing yourself, please?
Yes, well, it's a pleasure to be with you, Andy. I am chair of Healthwatch England. I also sit on the board of the Care Quality Commission as a non-executive director. I, until March, was a full-time practitioner at the bar, now given up some of that at least. I used, best known, I suppose, for chairing the Mid Staffordshire Public Inquiry, and it was really through that I got involved in the health world in this regard. I've always specialised in medical law, and I suppose it's no coincidence I ended up at Healthwatch, given that I saw quite a bit about the good things and the bad things about patient and public involvement, as it was then called, around Mid Staffordshire and indeed in the country. And it became absolutely clear to me that something needed to be done about the way in which the health service and the care services engaged with the public and the people they're meant to be serving. And through that, I actually joined the Care Quality Commission when I was asked to, and I was delighted to be asked to chair Healthwatch England.
I from all my contacts across the network, I know we cheered when you were appointed as chair because of your part in the past. Thank you for that. So I've got 4 questions for you, Robert. The first one is about this. So how have you been looking after yourself during the pandemic?
Well, I think I'm fairly fortunate in that I live in the countryside. We have a house, we have a garden, so it's been easy to control our lives in a way, which I'm afraid the vast majority of the population are not able to do. And it's been a revelation sitting in front of this computer that I'm talking to you on and working in that way and seeking to support Healthwatch as well. And in some ways, life is much less stressful. In other ways, it's more stressful. And it's difficult, I think, communicating with people all the time through computers rather than with physical contact. But there are some good things about it. I noticed one of your interviewees at least has acquired a dog. I've done the same, and I'm now dragged on walks into places I never knew existed around here, and I meet, socially distanced, of course, a completely new community of people, which has invigorated my life.
That's lovely to hear. Thank you. Okay, my second question is this. So how has the pandemic situation affected your responsibilities as chair of Healthwatch England?
Well, partly through what I've just said. I love meeting people. That's and I'm interested in what they've got to say and their personalities and so on. And some of that's just been taken away. But in terms of running or leading Healthwatch, Imelda and her team have done a fantastic job in just setting themselves up at home. And we continue to communicate both as an organisation and as a committee pretty well as we did before. And in some cases a bit better, because actually there is a more continuous form of communication. And I think it's working very well, but it is a different environment, and I'm not sure the extent to which we will go back to what we did, the way we did it before, because we suddenly realised you don't need an office as much. But I'd be sorry to see that go completely. But that's how we've been running it. So my responsibilities as a chair, I think, have changed in the sense that it's necessary to make sure morale is being kept up, and we do that by regular communication. Not all of it the serious business, but quite a lot of it in that way, and just making sure that people aren't losing touch, and particularly because our job at Healthwatch England being to communicate with local Healthwatch, you and your colleagues, and I've been very keen to ensure that we keep those lines of communication open, that we are supporting you by providing you with information in challenging circumstances, bearing in mind the information, the guidance seems to change every day, if not every hour. And we very much want to concentrate on supporting you in these very difficult times.
Thank you. I can imagine for an organisation that's stretched to try and cover the whole of England, the virtual field is actually helped in a sense, but I completely get the fact that you can't come away from face to face because you need that human contact, don't you?
Yes, I think it has. I think in one sense it's strengthened our network because of the need to do it this way. I think where it becomes much more challenging is actually the other part of our job, which is projecting what you want us to say to central government, because the normal means of communicating with government are not there in the way that they used to be. But we have maintained pretty good contacts with them, and when things have needed attention, I think on the whole we've been able to get it.
And in your role as chair, you also said in the introduction that you sit on the Care Quality Commission's board. Has that changed?
Well, it changed in the sense that, like everyone else, we're reduced to having virtual meetings. We clearly, at the beginning of the pandemic, the Care Quality Commission had a huge job to do to change its way of working. And that required us to have weekly board meetings to make sure that things were being done appropriately and to keep ourselves up to date. And of course, it's a much larger organisation. But on the other hand, a lot of people working for the Care Quality Commission already work from home, and so we already, in fact, had the sort of infrastructure necessary to allow proper communications, transmission of documents, and so on. So I think of course, it radically changed, if only temporarily, the way in which the Care Quality Commission goes about its business. But we've been kept very busy making sure that's been possible.
My third question is this: so, what have been the noteworthy positives and the negatives caused by COVID?
Well, I think the first and foremost positive has been the incredible commitment of healthcare and caring staff, as evidenced in the work that they've done keeping the show on the road and continuing to look after people in trying circumstances. And I think we the public have always loved our healthcare workers, but I think there's been an affirmation, as it were, of that relationship, which I think is a strength that we need to build on going forward. The more challenging things that we hear a lot about, and I think all experienced, I think, is firstly the desperate need for clarity in the information and guidance we get about not just COVID, but also about everything else that's been shifted as a result. And I think when all this is over, if it ever is, we need to think long and hard about how information is communicated in a crisis. And I know that Healthwatch locally has been playing a very valuable part in that. So that's one thing. And the other thing that really worries me is the way in which what one might call normal healthcare has been was shifted to one side. And I think people feel that. We get a lot of feedback suggesting that people don't quite know what's meant to be happening about their condition, where they're meant to go, and so on, and how that's going to be picked up. And that is, I know is receiving more attention, understandably so, but that is something that worries me. I think that there have been positives around the accelerated integration by force, really, of services, and people have just done stuff that previously would have been put in the too difficult box, and I think that's good. But I worry about communities with whom it's very difficult to communicate sometimes, and who either are not getting what they need in language or through people that they understand or trust. And I think we need to look at that. And then finally, I mean, there is a list, obviously, but finally, in terms of the more principal ones, I did worry right at the beginning of this crisis at how the care sector was feeling it was being shoved to one side. And in particular, the effects of rapid discharge from hospital and how the care homes and so on or people at home indeed were dealing with that. And it just accentuated for me the absolutely essential work that needs to be done to bring the care sector much more centrally into the work that the health service does. And so everything is coordinated in a much better way. So I think those are my sort of principal things. I could go on about more detail. We are about to produce a quarterly intelligence report, which actually reflects some of this stuff and what we've been hearing. But it's I mean, one mustn't forget the difficulties that everyone has faced and the heroic way in which many of them have been coped with.
Yeah, that was a good way to end that answer, Robert. It was about recognising that the amazing response from key workers in the health and care sector. It was about, issues around health inequalities the gaps being widened because of poor communication and so on. And it is also about the future in terms of complex needs that people have been sitting on, or maybe even too afraid to approach doctors and the hospitals about. It's about waiting times now. And yes, absolutely, completely agree about the care sector and how it would have felt. We read about this nationally. We didn't really have any, the NHS works on counting things, doesn't it, quite often, but it wasn't counting what was going on in care homes, for instance.
No. Tremendous challenge at the outset in actually getting figures and the Care Quality Commission was, I hope it will be recognised in due course, central to putting this right, in ensuring that the care home sector and the figures that were coming out of that were being incorporated in the national picture in a way which perhaps they weren't at the outset.
Yeah. But the collaboration has been amazing, and as you say, the speed of change and cutting through what was bureaucratic in the past didn't appear to be an issue, didn't it?
And I just hope that doesn't come back again, but you never know.
Yeah. Absolutely. Let's learn from it, which takes us to the last question, which is about learning and challenges as we look forward from the outbreak. What do you think are the key learnings and the challenges?
Well, I think it's partly to do with we need to abandon the red tape approach to life, and which of course people always say, don't they? But I think what the pandemic has brought out is firstly what has always been there, the importance of thinking of the effect of what you do or don't do on people. And I've always say, it's people that matters, not numbers. Numbers are there to measure to some extent how well you're doing with the people, but never forget the people. I think there needs to be, we have demonstrated the need for much more consistent collaboration between various bits of the health service and the care sector, and the both of those with the public. And finally, I think actually it will be shown that where things have worked best, they work best when they've been done in conjunction with the people who are being served. In other words, the very space that Healthwatch actually occupies. And if you look around at the story about testing, tracing apps and all that sort of stuff, I think you'll find that it would be done better, and has been done better, where the people who are going to be using this stuff are actually asked about it before stuff is delivered. And there are so many instances of that I think we will be able to list in due course, that I think that is the big learning. Do not start with planning a great idea from the centre before you've discussed that big idea with the people it's going to affect most closely. And that, of course, includes the staff, but most importantly, it includes the patients, the service users, and the public in general. And I think that is easily forgotten in an emergency, but it's just as important in an emergency as it is at any other time.
Absolutely. What a fantastic way to finish a conversation about Healthwatch and the role of Healthwatch, because if you don't do it if you don't take the patient and the carer and the service user with you, you're going to get it wrong at some point. And you're right. I mean, I know that it dates our conversation, but it was in the news today, wasn't it, about test and learn apps and people being sent across the country.
Yeah.
Thank you.
I didn't actually know that because I haven't had time to even look at a paper this morning.
Robert, so thank you so much for your time. I really appreciate it.
Pleasure. Yeah.